Good afternoon, everyone, and good morning for those joining us from the West Coast. My name is Cyril Adam with Kognito. It's a pleasure to welcome you to today's webinar on integrating adolescent SBIRT throughout social work and nursing education. Today, it's my pleasure to welcome a distinguished panel of social work educators who will provide us with perspective on how they've been integrating adolescent SBIRT in their curriculum, and we'll be inviting you to a subsequent webinar in 2017 with a similar panel focused on nursing. So we're very excited to welcome you to this first part. Just a few notes of logistics for you for this webinar. This presentation will be recorded and will be available on demand on our website as well as on partners' websites. And so you will receive a follow-up email after this webinar with a copy of this presentation as well as the slides. For the duration of the webinar, we're going to have attendees in listen-only mode, so you won't be able to talk to us. You'll just be able to listen, but please do submit questions using the chat box on the right side of your screen, and you should be able to see that chat box on your screen right now. And finally, please connect with us. Follow us on Twitter. Our handle is @Kognito, and we look forward to seeing you there. So the agenda for today, we are first going to do some brief introductions and acknowledgments of our partner for this project. We will then have a brief overview of this project, integrating adolescent SBIRT in social work and nursing education. We will have an outline of the partnership between the Council on Social Work Education and NORC, which has been the driving force behind this project. So we'll talk more about that. And then three different programs, three different faculty members from social work programs around the country, in several cases who are collaborating with other professions in an interprofessional format, will share their experiences on how they've implemented adolescent SBIRT in their curriculum, student feedback on the curriculum, and on the simulation, which is the interactive platform that we will demo for you, in which these education programs have been providing their students as part of their curriculum. And finally, we'll have, of course, time for question and answers at the end, and we really look forward to a lively conversation with you all. Our presenters today are Andrea Bediaco, who is an Associate Director for Education Initiatives and Research with the Council on Social Work Education, and who will speak to us about CSWE's interest in this project and the role that they've been taking. And in alphabetical order, we will have Valerie Copeland, who is an Associate Dean in Academic Affairs, an Associate Professor at the School of Social Work at the University of Pittsburgh. Shannon Maeda, who is a Clinical Associate Professor at the University of Southern California at Dvorak School of Social Work. Stella Resco, who is an Assistant Professor and Substance Abuse Program Coordinator at the School of Social Work at Wayne State University, and yours truly, Cyril Adam. I'm a Senior Director for Health Programs at Kognito, and I've been leading this initiative on the Kognito side for the past 2 years. Some brief acknowledgements. This project is generously supported by the Conrad N. Hilton Foundation. If you're not familiar with the Conrad Hilton Foundation, please visit their website. They have been doing wonderful work for the past few years on adolescent SBIRT, and to really support the dissemination of adolescent SBIRT, as well as supporting prevention campaigns for adolescent substance use, and a lot of really great work that's been done on adolescent SBIRT, among other topics. Other partners, our key partners in this initiative include the Council on Social Work Education, the American Association of Colleges of Nursing. Both of these organizations are accrediting bodies for programs in social work and nursing education, and have been really big movers behind this initiative. The Center for Clinical Social Work, which is the largest association of clinical social workers in the US. NORC at the University of Chicago has been really leading this initiative and getting these partners together and providing a lot of subject matter expertise on the topic of SBIRT. And finally, the Institute for Research, Education, and Training in Addictions in Pittsburgh, which also collaboratively runs the National SBIRT ATTC. So it's a pleasure to have all of these partners in this initiative together with Kognito. Just to explain the overall aims of the project really quickly, our first goal in starting this project was to engage the leading national associations and experts and practitioners and students, researchers, and accrediting bodies in a project to disseminate competencies around substance use screening, brief intervention, and referral to treatment. Within the project, we have developed and implemented and are currently evaluating a curricula for substance use screening, brief intervention, and referral to treatment, a curricula which is complemented with an instructor's toolkit and Kognito's interactive virtual patient simulations, which provide students in social work and nursing with opportunities to actually practice SBIRT conversations with virtual patients or clients. Another goal was to offer technical assistance to all of those participating in the project in order to support the integration of SBIRT in their curriculum. And we did a lot of this by developing and bringing together an SBIRT learning collaborative, which is composed of faculty and researchers from schools of nursing and social work around the country who have been really helping inform how do we teach substance use in these programs? How can we include it in our curriculum? Where do we teach screening? Where do we teach brief interventions or motivational interviewing skills? And how can we best do that to provide the best experience to the students? And so finally, the overarching goal of this project is really to foster partnership and collaboration, a community of practice around adolescent SBIRT where we can really share what we've learned. So our first presenter today is Andrea Bediaco. Andrea is the Associate Director for Education Initiatives and Research for the Council on Social Work. And Andrea will talk to us a little bit about CSWE's role in this project. So Andrea, I'll give the floor to you if you're ready.
Thank you, Cyril.
Mm-hmm.
Screening, brief intervention, and referral to treatment, also known as SBIRT, is a comprehensive, integrated public health approach to the delivery of early intervention, treatment, and ongoing recovery supports for persons with risky and/or independent or dependent alcohol use. Previously, there was not much support for SBIRT training in social work, graduate and undergraduate programs, despite the fact that alcohol and substance abuse prevention programs have a large body of supporting evidence. SBIRT education and training is often optional or specialized education as opposed to required coursework. The Council on Social Work Education was awarded a subcontract from the Independent Research Organization, NORC, at the University of Chicago to support the integration of substance abuse screening, brief intervention, and referral to treatment, also known as SBIRT, to general undergraduate and graduate social work curricula rather than in advanced practice or specialty classes only. The expansion of insurance coverage for preventative care and substance use services by the Affordable Care Act and parity legislation makes approaches like SBIRT increasingly relevant to social work educators and practitioners. In October 2014, NORC partnered with the Council on Social Work Education, the Center for Clinical Social Work, and the American Association of Colleges of Nurses to support the integration of adolescent SBIRT into required coursework for their students. This is a 3-year project aimed at developing and evaluating curricula for undergrad and graduate students. All schools are invited to participate in a learning collaborative with NORC to share their experiences, learn from other educators about integrating substance abuse education into existing curricula, and obtain additional resources and materials. And I will now turn the presentation over to our speakers.
Thanks so much, Andrea. And great to have CSWE's participation in this project. Our next speaker is Shannon Maeda. Shannon is a clinical associate professor at the USC Susan Dvorak Peck School of Social Work. I hope I pronounced this correctly. And Shannon is going to speak with us about USC's experience implementing this in their program. So Shannon, I'll turn it over to you now.
Thank you, Cyril. Can you hear me okay, everyone?
Yes.
Yes? Okay, great. Okay, hello, everyone. So I would like to present just what we did and how it went. So what we did at the USC School of Social Work is provided a pre-test, the Kognito online interactive simulation, and the post-test. And all of this was done online. We provided it both to students on the ground, and we also have an online MSW program and provided the opportunity for our online students to participate as well. So the pre-test, we had about 130 students conduct the pre-test. We had 204 students do the simulation, and we had 86 students doing the post-test. And so the first challenge was to get the buy-in from the faculty. And there were a few challenges around this, and as I listened to what people were saying, there were basically two big challenges. And one was that the syllabus is already packed and that there was no room on the syllabus to put one more thing in there. But as I listened more closely, I thought that that challenge was mostly because of the second item, and that was that at USC there are few faculty who have expertise in teaching and talking about addiction, especially with adolescents. And so as I talk to people about what SBIRT actually is, and showed them that it's not really all that much different than content that they already know about, such as motivational interviewing and just basic good clinical skills, and that it's just packaged in a particular way, then faculty had more motivation to find room in their class discussion about this. I also wanted to note that our administration, our executive vice dean, was very much motivated to get the SBIRT word out, and so he and I worked together very closely in, as I would send out the instructions to the students, he would follow up with a very enthusiastic reminder and a motivator to have students participate. And I think having the administration's buy-in on this, it offered just another level of legitimacy, which I really appreciated. With regard to buying in from students, I felt like there was lots of motivation around this. USC really pushes evidence-based practices. I keep in touch with colleagues who, in the field, who are supervising USC students and some of the other universities locally, and they all tell me that USC students are head and shoulders above the other universities because of the evidence-based practice that we push. So here we were, right, pushing another evidence-based practice, SBIRT. Additionally, having this content and having these skills makes these students, makes these graduates very marketable, and it also gives the opportunity for these students to feel very competent. So students had good buy-in in participating in this simulation. So at USC, we have both traditional students that are right out of a bachelor program, and we also have a significant number of non-traditional students. And their feedback was some of the following. I also want to note that when students had questions or feedback, they emailed me directly, and I responded to each and every email personally. And I did that, one, because I was asked to, but two, I did it very enthusiastically because our school is very big, and sometimes as the school is so big, the personal touch gets lost, and I wanted students to have that personal touch, and also someone directly who they felt like they could be in contact with regard to questions or any kind of feedback. So just so you know, I responded to each and every email. Some of the students did send their email to some of the SBIRT team, and they sent those emails to me, and then I responded to each one. So generally speaking, the feedback was extremely positive. These students really liked the simulation. What they liked about it was they were taught very effective, concrete responses. I don't know about other universities, but at USC, students are very anxious about being out there and doing this work, and they want very concrete responses. And this SBIRT simulation, it gave them that, concrete, effective responses. They also responded that they liked that the simulation was cartoonish, if you will, because in practicing responding and talking with the adolescent in the simulation, they could give it a try without knowing for certain the correct response, and that they liked that they could try, and that if they made a mistake, they weren't hurting a real person. So they liked the cartoon effect. We got lots and lots of emails from students just really expressing their appreciation for the training, for the items that I mentioned, but just very appreciative, and that they felt more competent and confident on their internships. We did get a handful of students who requested to opt out of getting all these reminders, because I did send out quite a few. And as we did this the second time, I made certain to put one sentence in the beginning of the email that was highlighted to say, this is completely voluntary, and we're sending out this information by email blast, and that there's no way to opt out. And I put that in highlight because we all have a tendency to scan emails, and if it was just put in at the bottom or just with a lot of words, people may not have read that. So that was one piece. I found that a couple of items to help integrate this information into the curriculum. Our students are very focused on assignments and how can I get points. And so I found that in the courses that I teach on addiction and recovery, that I would include having done the training and turning in their certificate of completion, that I would give them points. So this is much better done if connected with an assignment and some points. Also, since many of my students were doing it, this simulation, that they wanted to talk about it. They wanted to just have an opportunity to reflect on the experience and say which parts of the experience stood out for them. So another strategy for integrating this information was to just have a bit of time in the class sessions to discuss the experience. Let's see, another piece that maybe I should have said this earlier, but another piece with regard to getting faculty buy-in was having personal conversations with faculty to explain what is SBIRT, and asking them just very, very directly what could be done to help get this into your class. And just to have a conversation, a personal conversation about what kind of barriers were there. And as I mentioned, some faculty felt like, oh, is this one more thing I have to learn to be able to competently talk about it in the class? And having a guest speaker to come into the class was another way that faculty were willing to bring this into the curriculum, and yet they didn't have to learn something new. So having a guest speaker is another good strategy. So this went so well that we applied, USC and through me, applied to the SBIRT team to do it again. And so we're now in the track C, and now we are including our nursing students in this opportunity. We also offer a course on adolescent gang prevention and intervention, and we've extended this opportunity to this undergraduate course. It'll be interesting because, as I mentioned, USC really pushes evidence-based practices, and right now they are offering, or actually I say offering, but it's mandated that the students go through an SBIRT training for general populations. And when I talk about it in the class now, I see students looking at each other, and so I ask, what is this? What are you reacting to? And they say, well, we have this. We have to do this already. So they weren't so motivated to maybe do this simulation. And so it gave me an opportunity to tell them a couple of things. That, number one, this particular training is specific to adolescents, and we work with adolescents in a much different manner than we do general adults. And so it will be new in that way. However, just being an instructor and just being a learner myself, I appreciate myself when I hear something and I can say, oh, I know that, and be able to just recognize the information. And I think in doing that, we have the opportunity to build our clinical competence. And so this is one thing that I tell students who may, they have to do this training at school. And so I say, go on and do it. This builds your clinical competence. You'll recognize the information. Additionally, I just personally like to hear different perspectives on the same topic. Maybe I'm going to learn a few things new when I hear a different speaker talk about it. In this track C, this next time that we're doing it, I've also had a couple of requests from field instructors. And the students are so excited about it that they're talking about it with their field instructors, and the field instructors are asking permission to go online and do the simulation as well. They want to know it for their own clinical skill set, but they also want to know what is it that these students are learning so that they can help the students be more effective and sophisticated in their practice with the clients. So that's my presentation. I'm happy to take any questions at the end. Thank you for inviting me to do this.
Thanks so much, Shannon. It's great to hear about your experience and the great feedback you got from students, and there was a lot of information and tips on how we can implement SBIRT in those programs. Thank you so much.
Thank you.
Our next speaker is Valerie Copeland. Valerie is an Associate Dean for Academic Affairs, as well as an Associate Professor at the School of Social Work at the University of Pittsburgh. And Valerie will now talk with us about their experience at the University of Pittsburgh. So Valerie, I'll hand it over to you now if you're ready.
Thanks, Cyril. I want to warn the audience that some of what Shannon found at USC was very similar to what we have found here at the University of Pittsburgh, and we've done a couple of things. So if there's a little bit of repetition, just be a little patient, and hopefully we will all end up at the same place. But in terms of the skepticism, our faculty was very skeptical also because they felt that they had not had the preparation themselves, and without the preparation for themselves, they were concerned about how they would transfer the SBIRT knowledge in the classroom. they were not sure which teaching methods to engage. And they weren't sure where the different pieces of the model would fit into our existing curriculum. They were also skeptical about learning and becoming familiar with the Kognito simulation program, which you're going to hear about a little bit later, but that was another barrier. Or I, since I was the PI on the project, had to figure out where to start. And as a social worker, I tried to start where our faculty was because their needs were different. The level of confidence was different, and the willingness to try something new required a great deal of trying to stay on topic. Some of our faculty had been introduced, again, I think as Andrea said at the beginning, that SBIRT has been introduced in social work before, and it may have been around the time we were doing a lot of work in short-term treatment, and so some faculty remembered, oh yeah, I remember talking about that a long time ago, and didn't really go anywhere, but it was very clear that with this project, we wanted it to go someplace, and we wanted to integrate it into our curriculum so that it would always be there, that it was not just because of this project, but it would become sustained. We had to consider our adjunct and our part-time faculty and what they needed and how we could support them. And so, there was a knowledge base, and there was also the use of this simulation that was part of the application. Yeah, you can move to the next slide. Thanks. So because we weren't sure where to fit it into our curriculum, and in the grant, we had proposed weaving it throughout. We didn't want it in a separate course. We didn't want one person to feel responsible for the entire component of SBIRT in our curriculum. So we looked at the entire curriculum across all three of our programs, our baccalaureate program, our master's program, and our PhD program, to try to figure out where it would fit. We wanted to avoid duplication, but we wanted to build the content sequentially so that students would be able to self-test themselves when they got to the use of the Kognito. And so in using the Kognito portion of the knowledge development of SBIRT, the Kognito portion came in the advanced courses. So the foundation pieces were in the core curriculum, and then the use of Kognito was in the advanced curriculum. And one of the reasons we put it in the advanced curriculum was because students, we kept hearing students say, oh, well, I've learned this already in another course. I know this. So we said, okay, well, if students are saying that they're getting the repetition, and if they feel like they know this, why don't we put the Kognito at the end? And that allows them to test themselves, and then they can find out how much they really know. And if you know some about Kognito is very self-paced, and if students start with the scenarios and start testing themselves through each scenario, they get a score. And at the end of the Kognito presentation, they get a certificate or they get acknowledged for completion, and they get a percentage of their rating. So if they received a 69% rating, they could just keep going back until they perfected the skills that we wanted them to learn. And, you know, as Shannon says, you know, students always want to be at the top. So this gave them an opportunity to go back and to learn more in depth about using those skills, because they were going to be rated within the Kognito system, not necessarily in the classroom, but they could take their acknowledgement of completion for the Kognito program back to the classroom, and the teacher would see that. We wanted, as I said, all of our students to know the SBIRT curriculum, and we didn't want to put it in a particular course. So, as I said, we selected some of our core courses in the foundation portion of the curriculum, and then we selected advanced level courses, and we selected the advanced level courses that we knew all the students would have to take. So the way in which our curriculum is set up, we have direct practice and macro concentration. So there are several classes in our curriculum at the advanced level that all of our students have to take, and we figured that we would get that information covered in those classes. Although the specialty classes that we have, like drug and alcohol, we have someone from the community who teaches that class, and he was already integrating that into his class. We have a children, youth, and families certificate, so we made sure that the students that were in that particular area of the curriculum were receiving the SBIRT knowledge. So we just went full frontal in trying to make sure everyone was covered. In our baccalaureate class, we have one course where all of our baccalaureate students have to take, and it is an introduction to working with individuals, groups, and families. So the students were introduced to SBIRT and that particular course, and that was all. They were just given an overview. And in our PhD program, we have a course that's micro systems, the social systems, social theory 1. And in social theory 1 is where we cover all of the micro theories in social work practice. And the professor who teaches that class in our doctoral program integrated the SBIRT content into the course at the time that they were talking about motivational interviewing and the theory behind motivational interviewing. Motivational interviewing was also coupled with SBIRT at the MSW level in a couple of our classes. Let's see here where we are. We had the comment, everybody's course is already full, and one of the things, I've been in social work for a very long time. I got my undergraduate, my master's, and my PhD in social work, and one of the things I always have been cognizant about social work is that social work faculty get very comfortable teaching the same thing over and over and over and over again. And when you get ready to suggest something new, they always say, well, my course is full enough. Well, in our review of courses, as we decided to implement the integration, was to have faculty consider taking things out of their course that was no longer useful. And so they had the opportunity to take old stuff out and to put new stuff in. And when you put it that way, people can try to find a way. They find a little open door where they can put in information, but they have to be reminded that we're not teaching yesterday's students. And so we can't use yesterday's course material to increase the knowledge base and skills for our students. So we have to update our course information. We used a box that was accessible by all of our faculty so that everybody would have access to the information at their leisure. We did develop the phase-in plan, and we did develop the foundation and advanced classes, as I spoke to. We have 2 branch campuses, and our branch campuses are located in rural areas of the state, and we wanted to make sure that what the students were learning in their courses in the main campus, that those courses that students were taking at the branch campuses, we also included the SBIRT. So we had the direct order coordinators from those programs involved in the planning so that everybody felt included and everybody sort of knew what was expected. So we didn't want branch campuses to be left out. When we talk about interprofessional education, we wanted to make sure that our students, now given ACA and all of the other changes in healthcare, learn at this level, at the classroom level, what other professions do, because they're going to be working in interdisciplinary settings. And so we engage in a day of joint training with students in nursing and dental hygiene. And they, our colleague Ann Mitchell in the School of Nursing, who has one of the larger SBIRT grants on campus, and we see here at Pitt as the expert in SBIRT. She and her faculty developed several scenarios, and these were real live scenarios that we put into action in the School of Dental Medicine. And so we had actors, and we gave them scripts, and then the students had to go in and evaluate the stages of change and where people were in terms of SBIRT, and then they had to do the warm handoff. So the dental hygienist would initially see the person. They would hand off to the nursing student, and then the nursing student would hand off to social work so that social work would be able to share what resources were available in the community. And it gave us more than just the knowledge base of what each student was doing, but the students themselves were surprised that social workers did more than working with child welfare families. They were very impressed with social work students' communication skills, and they I'm sorry, I had myself time. They were very impressed with our students' social work skills and their knowledge of the community. So the working group training went very well, and we've continued to do more of that on campus. We have an annual interprofessional education conference that students from nursing, medicine, public health, health and rehab sciences, pharmacy, and dentistry attend once a year. And now we have made more connections with the National Center for Interprofessional Training and Education now that CSWE has become more involved in that. So we found that the cross-campus collaborations with the health sciences program enriched what our students were learning about SBIRT, and it allowed them to engage in some collaborative learning with the other programs. And I think finally we can look at what we did with regards to our field education. If you notice on the slide, and I think Shannon mentioned this, that they were getting calls from field instructors wanting to know about SBIRT because they wanted to also have the knowledge that the students were applying in the field. Well, what we did when we integrated SBIRT into our curriculum, we simultaneously integrated SBIRT into our field instructor training because we knew that if we were sending students out in the field with this new knowledge, that we would want our field instructors to have the knowledge, because that way they would learn how to turn appropriate activities into learning activities. We had a one-day CE program for professional staff working in the field, whether they were field instructors or not, and we offered scholarships to them. And we integrated their training into our orientation, into our seminars, and we've also started doing some remote training where instead of having field instructors come to the university, the selected field education staff will go out to organizations where they have, groups of social work field instructors who aren't able to take time off to come into the university, but they can engage in a field training right at their work site. I'm going to stop right here because I think my time is over. But the next couple of slides, you can see where our use of the Kognito has improved. If we look at where our students were back in February of this year, and if you look at where they were at the beginning of December, the more we have used it and the more students have learned about it, the more excited they have wanted to use it. So the combination of the classroom coursework and the use of the Kognito simulation suggests to us that our students are enjoying what it is they're doing. I mean, they have some complaints, and we can talk about that another time, but for the most part, we're pretty happy that the use of Kognito is so popular among our students. Thank you.
Thank you, Valerie. And yeah, I'd love to hear some of the feedback that students had, the good and the bad. It's always good to understand our users, yes, and the barriers that they may encounter. So okay, thank you so much, Valerie. Our next speaker will be Stella Resco, who is an assistant professor and CADAS coordinator at the Wayne State University School of Social Work. So Stella, if you're ready, I'll give you the floor.
Thank you for that introduction. And thank you also to Shannon and Valerie for sharing their work. I'm going to be echoing some of the comments that they made and sharing what we've been doing here at Wayne State. And we've utilized the simulation in several areas of our social work curriculum and working with our BSW and our MSW students. So one thing that we've been doing is focusing on our substance use courses and focusing on some of the elective courses that we have for our bachelor's and master's students, also some of our advanced practice clinical courses, and also a few independent studies. But these courses, generally they're elective, but they also can be part of our graduate certificate in alcohol and drug use studies. And one of the reasons that we, quite frankly, focused on this area in the beginning was the receptiveness of the faculty. Many of the faculty in this area were familiar with SBIRT, and so they were much more receptive to incorporating it into the curriculum in these areas. So for these students, what we've been having them do is complete the simulation and then also a brief questionnaire where we're following up the participants to try to get some information about what they're taking away from the intervention, how they find it useful, what aspects of it are particularly useful, as well as other ways that we might be able to improve this simulation in the experience of our students. So primarily, they're closed-ended questions. We have a few open-ended reflection questions as well. But those are the types of things that we wanted to kind of get from our students and really, see what they take away from the experience. What's useful for them, how they find it helpful, and that type of feedback. We're also asking our students at this point, too, if we can follow up with them to collect some additional data. So we're asking if they'd be willing to allow us to contact them to participate in a qualitative research study. And again, that would be separate, from the coursework they're doing, and we are going to provide incentives for that. But we want to kind of get some richer data to kind of really uncover, what the student experiences are like. And so we're doing that as part of the work at Wayne. Now, in terms of the feedback, a couple things to keep in mind about our faculty teaching these courses is that, one, not all of our substance use faculty are actually familiar with SBIRT. Many of our instructors, and particularly our part-time instructors, they have backgrounds in substance use treatment or prevention. And in treatment settings, there's not as much of a focus on SBIRT. A lot of the work with SBIRT is happening in other settings like primary care or emergency room settings. So a lot of our instructors, even though they're well-versed in substance use, weren't as familiar with SBIRT. In order to kind of, meet the needs of our faculty, both our full-time and part-time faculty, we found it was much more helpful to, meet with each faculty member individually who is going to be using the simulation and the SBIRT curriculum in their classes, and that helped us really build faculty support. It also was really helpful because some of our instructors were just asking general questions about SBIRT, just they weren't as familiar with it. But they also then had some, more technical questions about the simulation, like how does it work, what do they need to tell the students, how do they access it, how do they operate it once you're in the simulation. So by meeting individually with each person, we were able to kind of go through and work through some of those different types of questions that they had. Now, we're also focusing on our generalist practice courses, so in addition to the specialty substance use courses. And for these, we were focusing on, can you go to the next slide? We were focusing on our BSW and MSW foundation year courseworks. And initially, when we tried to kind of incorporate the SBIRT curriculum into these classes, we ran into a few roadblocks. I think similar to what some of the other, what Valerie and Shannon have kind of shared. We got the comment back from some of our lead teachers and from the instructors that, it's an important topic, but we don't have time. The idea that, our curriculum is very, jam-packed. We already have a lot of content in there. We don't have time to do everything else. So that was definitely one challenge that we found. Another challenge we also found was that, when we focus on our generalist practice courses, we have instructors that don't have backgrounds in substance use in many of those situations. So the receptiveness also wasn't as strong, and they weren't really as well versed with like SBIRT or that content area. We made efforts to also incorporate the simulation in other courses as we were trying to figure out, where does this best fit in our curriculum. We found one of our courses that's a requirement. We have a DSM or assessment course that is part of our MSW program, and we thought that would also be a great fit for the SBIRT simulation and for some of this content. But again, the challenge of kind of adding it to a class in particular, that's a 2-credit course. And so we had the difficulty of, the instructors and lead instructors not feeling like there was adequate time and ability to kind of include it in those courses. So the compromise that we've kind of gone with is actually having some of these courses, our generalist practice courses, use this as an extra credit option for students. So the students would then complete the simulation and do the brief questionnaire, the same questionnaire we're doing with the substance use courses. And for this, we've been introducing the project via emails. We've also been meeting with instructors. I think, you know, the fact that we're not meeting individually with each instructor, though, definitely makes a difference. And so I think in terms of the buy-in and support, we definitely have a lot more support those times when we're making that effort to individually meet with people. But for the generalist courses, this is kind of the approach that we've been using. Okay, next slide. So in terms of the feedback that we've received from our instructors, both from the substance use courses and as well as the generalist practice courses, overall it's been very positive from our instructors. One thing that I think really stood out is that the instructors like that this isn't just a passive viewing. It's not a passive assignment, that the students are actually engaged in the process. They found it really helpful to have students have a safe place to try out that clinician role, how to, you know, give the students some sample scripts, some ideas of what to say, what types of questions to ask. It also gave the students, you know, ideas of what not to do. So having those examples were things that some of our instructors liked. Just logistical issues too were important. So things like being able to save their place and complete the training at another time, that was also something our instructors really liked. It had the flexibility where it would be accessible to our students, which is important. And one thing too that the instructors felt was helpful about this simulation is that you could also use it in different ways as the instructor. So for some of our instructors, they actually wanted to use this as a class, instructor-led exercise in the classroom. So maybe instead of having students complete it on their own, they would actually go through the simulation in the classroom setting and as a group kind of come up with what should we do next or which question we should ask. Other instructors felt it was helpful too because it was something that the students could do outside of the classroom, that they could assign it as an assignment. And I think that's particularly important when we have these curriculums in our bachelor's and master's program where there's always the fight to kind of get the content in there, and I think there's a lot of concern, you know, we don't always have room to address everything. So that was definitely a positive thing that our faculty felt. In terms of some concerns about the simulation, one is just the general access to it. The idea that, you know, is this just a short-term project? Can we only do it for a year or two and then is that it? You know, how do we kind of do it more long-term? That was definitely a concern from our faculty. And then also just the time. So I've kind of mentioned that, you know, with the curriculum being fairly full and there's a lot of kind of concern that, you know, it's an important topic, but, you know, where do we fit it in? And in terms of like what classes make the most sense to fit it in, that was another concern. In terms of areas for improvement, a couple things that our instructors brought up was this idea. One was they wanted to actually just assign portions of the simulation or the ability to skip ahead to different sections. So the way it was designed, and it may have been because of the CE options for this, but the students had to kind of complete the program sequentially, so they couldn't just skip ahead and do just one particular simulation. They had to kind of start with the first one and then move through. The other thing that came up was the scenarios that were used in the simulation. I think some of our faculty would like to see additional scenarios, including some situations that are going to be more relevant to teens and in poor urban communities. Our university is located in Detroit, and so just in terms of, you know, having scenarios that are going to be relevant to the social workers that are going to be working in Detroit or working in some of the surrounding communities, that was something that our instructors brought up. They also wanted to see kind of greater diversity of the social workers and the adolescents in the simulations. And in particular, they wanted to see more African Americans, just given the population of our students, but also the community here in Detroit. And you know, one of the things I think as we got feedback, there was one of the scenarios in particular, like the scenario with Josh, where he jumped off the roof into the hot tub. That was one of the scenarios I think that was brought up several times by instructors, that it wasn't necessarily the most relevant type of situation. It sounded more like a spring break type thing. And I think for some of our instructors, the idea of finding some sort of scenarios that are going to be, you know, directly relevant to this community and include more diversity, that would be something in the future we would love to see more of. The other thing, we also had some of our instructors that felt that the substance use, that the introduction to SBIRT was also not necessarily needed as part of the simulation program. So there's kind of a short introduction to SBIRT. So some, again, wanted to be able to kind of choose if they had to cover that material or not. And in terms of our student feedback, we're in the process right now of doing our evaluation for incorporating the simulation and the SBIRT content. And for our evaluation, we're doing a few things. One is just assessing our students' knowledge, their skills and abilities. So getting an idea of, you know, what are the students learning, what they're taking away, what they're able to do after they take part in this experience. We're also evaluating our implementation of the SBIRT curriculum. So it's not just, you know, what the students get, but is there a way that we can kind of do this a little bit better for them? And so for the evaluation, we have a post-test only design, and we're collecting some of the data through a web-based survey. Again, most of that is going to be, you know, primarily closed-ended questions, but we do have a few open-ended questions as well. But the follow-up piece that I think is going to be particularly interesting is our qualitative component, where we're using moderated discussion boards through Blackboard to collect data to kind of get more in-depth kind of information about the experiences of our students as well as our instructors. So we're having one discussion board for instructors and one for our students, and trying to kind of get some insight, additional insight on kind of what their feedback is from participating in the simulation program. And
thank you, Stella. Thanks so much. I really appreciate getting this inside view into your program. I was frantically taking notes as you were speaking. There's a lot of really good lessons learned there, and certainly the diversity of scenarios and things like that we're actively looking into. So it's great to hear this feedback. Thanks so much, Stella. So I wanted to give you a brief view into the work that Kognito has done within this project, as well as show you the simulation. Cognito is a small business based in New York City that has been in existence for about 15 years now. And we really focus on preparing people to effectively lead real-life conversations that can help drive improvements in social, emotional, and physical health in other people. And so we developed simulations such as the ones you can see on your screen. You can see a couple of snapshots here that allow individuals and professionals to engage in role-play conversations with emotionally responsive virtual humans. These virtual humans have their own personality, their own memory. They have a health condition that they bring with them, and they have a lot of personality. These are not flat kind of generic characters. Each of them, just like the clients that you see in your daily practice, bring their own story to the table, which will be very important in discussing certain health issues. Our approach really aims to combine learning design principles and the science of learning as well as the art of conversation and using collaborative techniques to engage others, such as motivational interviewing, as well as the power of gaming technology, which we can really leverage here to give learners the best experience possible and the most effective possible. I wanted to note a few things about our simulation. You can see on the left here some of what we teach, such as motivational interviewing, shared decision making, mentalizing, which is the ability to tell or predict what somebody else's thoughts might be at any given time, or for example, empathy, the ability to tell or to feel the feelings that others are experiencing. So a lot of this has to do with communication skills, but also changing attitudes and helping raise the empathy of professionals towards the clients and patients. Some of the key learning principles that we use, for example, are hands-on practice. These simulations give you the opportunity to engage in deliberate practice in conversation with these virtual humans, which really is a key feature, as we'll see in a second. An analogy that I often use is that communication skills are like learning to ride a bicycle. You just cannot learn those by reading a PowerPoint or watching a video on YouTube. You will need to have more or less structured learning experience, and you will drive your bicycle, right? You will drive the experience, and you may have a coach who gives you feedback, like a parent who will help you see what you're doing well or not well. And over the course of this deliberate practice, we'll be able to take away the training wheels, and you'll find your own balance. Learning communication skills is very much worked the same way, where you can give a few pointers to people or some conversation starters or a framework, but really the skill and the comfort in navigating these conversations will come from the ability to actually practice and receiving feedback on your performance. Very, very briefly about our development process. This simulation was developed through an iterative process with the Learning Collaborative and the advisory panel on this project. So we got a lot of input at every stage of the process from subject matter experts who reviewed the conversation scripts and all of the design. So this was truly a collaborative effort in which all of these schools and experts really took an essential part. So without further ado, let me jump into a demo of the simulation here. And you'll get a chance to see Josh's story, where Josh presents in the ED, as Stella mentioned, having jumped off a roof into a hot tub while he was drinking at a party. And so once his ankle has been taken care of, a social worker who is working in this healthcare setting, kind of showing the expanding role of social workers. So the social worker working in a hospital context will have a chance to have a conversation with Josh about his screening results and about the role that alcohol may have played in his injury. So here the social worker, is going to introduce herself, and I should note that you can actually play the simulation as either a social worker or a nurse. So we try to adapt this to the learners. So let's see how this conversation goes.
Hi, Josh. I'm the social worker that Nurse Lopez mentioned.
Yeah.
How are you feeling?
Well, I've been better.
I'm sorry to hear that. Mind chatting with me while we wait for your x-rays?
I don't know. I'm pretty slammed today.
So, yes, you can talk?
Yeah, sure.
And so our first goal will be to build rapport with Josh, perhaps before jumping into talking about alcohol.
So just to help me get to know you a little better, what kinds of things do you like to do for fun?
Well, you know, there's like nothing to do in this town. I hang out with my friends.
What kinds of things do you do when you hang out?
We chill, play video games or whatever, some pickup football.
You like to play video games and football with your friends. Are you on the school team?
Yeah. Next year I should go varsity.
Okay, so here we modeled the setup of the conversation a little bit for the learner to kind of give a little bit of background about why Josh is here and trying to model how we can build a little bit of rapport with him. At the bottom of your screen, you can see the window that pops up that tells me that my goal is to build rapport and gives me a couple of suggestions on how to do that. And throughout the conversation, you will have every step of this conversation that will be outlined for you. So you will have a few pointers to, in the next section to understand how to talk about the pros and cons of substance use, for example, and how to provide some feedback about that. On the right-hand side of the screen here, you can see Josh's engagement meter. You can see that at this point, he's not very engaged in this conversation. He's had a tough night in the hospital, and he's probably wondering why he has to go again through this conversation with you. And so you will see this meter move up and down according to how well you do in the conversation. And the idea here is really to translate Josh's reaction. You will hear how he responds to what you say, but for those learners who may have a less experience or a little more difficulty interpreting those verbal or body language reactions, the meter really helps kind of quantify that for the learners. And finally, in the upper left corner, you can see the talk button here, which gives you a variety of options, effective or ineffective, for things that you can say to Josh. So we can raise the subject by asking, may I talk with you about your responses? Or we can be a little more abrupt and say, we need to talk about your answers to the substance use questionnaire. Or we could jump straight into giving advice to Josh, for example, and explain that drinking is dangerous for someone his age. So let's start with that, which might be a place where many professionals start, and let's see how the client responds to this.
On the form you filled out, you said you regularly drink.
And here comes the lecture in 3, 2, 1.
I don't want to lecture you. It's just really dangerous for someone your age. I mean, look at what happened today.
Oh my God, you're right. It'll never happen again. I'm so glad you were here to set me straight.
So here the coach comes up. This is Coach Amanda, who really walks us through the entire simulation, and she comes here to tell us that we jumped into giving Josh advice a little bit too quickly, and as we said, he's already having a tough night, and this just serves to disengage him when we try to give him advice right from the get-go. So one thing that we're going to be able to do here is to click the undo button. And I'm sure you all wish you could do this in real life at one point or another. I'm sure we all have. But you will be able to take back what we just said and make a different choice. So here we went back in time, and the option we initially chose is grayed out, and we can choose something else. So let's try to bring up substance use, and again, we have two different ways to do that. We can ask for permission, or we can kind of impose that topic on him. So let's say we need to talk and see how he might respond.
I saw your answers to the substance use questionnaire about alcohol and drugs, and we need to have a talk about it.
Here it comes.
So Josh didn't even push back that hard. He just kind of rolled his eyes and said, here we go, as if he fully expected this kind of lecture to be coming his way. And so the coach comes in telling us that the way we raised the subject, saying we need to talk, really pushed our own agenda. So this starts to get the learner to understand the difference that just a few words can make in how we bring up a specific topic, and saying, may I talk with you about your responses, or we need to have a talk will make a world of difference. So let's see how much better he might respond when we ask permission.
I noticed you filled out the questionnaire about alcohol and other drug use. We ask all of our patients to complete that. Thank you for being honest on it. I'd like to talk with you for a few minutes about your responses. What do you think about that?
Oh, okay, I guess.
All right, so Josh is still not, jumping up and down at the idea of talking about his alcohol use with us, but he's at least okay with it. And here you see a little speech bubble next to Josh's head. Again, a tool to improve the learner's emotional intelligence. We're able to listen to what Josh is thinking at this point, which will prepare us to better be able to tell what a patient might be thinking.
I didn't think anyone would look at that thing. Maybe I shouldn't have been so honest.
So here Josh says, well, I didn't think anybody would look at my screening form, my intake form, which is a very common thought for adolescents who will again and again bring up some privacy concerns. And you will have many opportunities in this conversation to reassure Josh that this is a private conversation and how you will be able to keep this private, or circumstances in which you might need to tell somebody else. But again, these privacy questions very important to adolescents, so you'll have many chances to bring them up. And there are also a number of resources in the resource section of this simulation where you can find out more about privacy. So let me go back to our slides. I think this gives you a good sense of how the conversation feels and works. You'll have a chance to go through every step of that conversation. This one is about 20 minutes long. And I just want to show you a few more features about this simulation. So you can see on your screen that we have 2 practice conversations and 1 assessment. So this first practice conversation takes place with Josh. We just explained that. And the second conversation is with a character named Emily. Emily has been using marijuana weekly as shown on her screening form, and she's been referred to the school social worker's office or school nurse's office by a teacher who noticed that she's been paying less attention in class. And so you'll get a chance to talk with Emily about her marijuana use. And what I really like in this conversation is that she'll start bringing up her parents' imminent divorce and the family issues that are at play, and how she has been using marijuana to kind of cope with all of that. So there's a kind of mental health component to this conversation that I find really interesting in terms of caring for the whole patient or client. And finally, the last conversation takes place in primary care, again, acknowledging the expanding role of social workers in healthcare settings, and where you can have a conversation with Kayla during her annual well visit. So Kayla is doing fine. She has no presenting complaint, but her screening form shows slightly risky use of alcohol, and so you can have a conversation with her and try to bring that up in a way that engages her as best you can. And you can see some of the other elements here on the menu where you can have access to additional materials and resources, survey, as well as a certificate. There are also some didactic elements that you will be able to cover, explaining screening and learning goals, screening and how you want to conduct this, clinical decisions, and how you decide to provide the right intervention depending on your client's risk level, motivational interviewing techniques, as well as the steps to conduct a brief negotiated interview. So all of this is taught within very engaging, animated, and very graphically engaging modules. And finally, a big component of this simulation is the assessment conversation, where we can give you an overall score and where you'll also receive a score on your use of motivational interviewing and how well you use that to engage your client. And we can then break down the entire brief intervention and explain to you what you did well or not well and where there's room for improvement, as well as your score for each section. And now, as faculty members, I'm sure what you're all wondering is, can you see this data from your students? And the answer is yes, absolutely. You have access to usage reports that let you see who accesses the simulation and when, and what score they got at every attempt at the simulation. I'm going to stop here. I just wanted to mention the wonderful resources that have been mentioned during this webinar, largely developed by our partners at NORC at the University of Chicago. You can learn more about the project at sbirt.webs.com, and you can also request a copy of the Learner's Guide for Adolescent SBIRT on that website, as well as the variety of learning resources and curriculum resources that have been developed within this project. You can also request technical assistance from our partners at NORC. Dr. Tracy McPherson, who is leading the SBIRT team at NORC, has done countless trainings in universities and healthcare settings and can answer just about any question you might have about substance use and SBIRT. So you can email her at esap1234@gmail.com. And with that, we'll open the floor for questions. I see a few of you who have submitted some questions already, but if you haven't, please feel free to use the chat box on the right and feel free to ask us your questions. One question that I'm happy to answer, one participant is asking whether there is a comparable simulation for adult SBIRT, and yes, please visit the Kognito website, or we can email outside this webinar. We have a variety of simulations that we've developed around both adolescent and adult SBIRT. There is a question about the list of schools that have worked to integrate SBIRT within their curriculum. Please shoot us an email, and I can get back to you individually. But I wanted to mention the fact that we are aiming to reach about 60 schools of nursing and social work throughout this project, and we're well on our way to reach that goal by September of 2017. It is about a half and half split between nursing and social work. So we have so far, I would say, about at least 20, 25 schools of social work participating in this topic. So if you have an institution near you, or if you are teaching in an institution where you are wondering where another program might be implementing SBIRT or participating in this project, please do reach out, and we'll be happy to help you and make connections. In several cases, we've made connections between the social work and nursing or other programs within a single university that didn't know about each other. So we're very, very happy to make those connections for you. One participant asks whether this has been utilized with nursing students. And yes, again, I would reiterate the fact that we will have a second webinar in 2017 focused on nursing. Nursing has been an integral part of this project. As I mentioned, about half of the schools that we've engaged in this project are schools of nursing, including, for example, we at Kognito have been working with the Johns Hopkins School of Nursing, which you may have seen on the news if you're a Baltimore resident recently. But so absolutely, nursing is a huge part of this project, and again, we're happy to provide more information. Finally, one participant asks, are the adolescent SBIRT screening tools such as the S2BI and the CRAFT free in the public domain? I believe these tools are free to be used by practitioners. I believe the general rule of thumb is that for researchers or commercial applications, you would need permission or a license from the authors. But if you are a faculty member, for instance, or a practitioner, my understanding is that you can use these tools freely, and we do in fact make these tools available within the simulation's resources. Finally, well, here's a question that one of our participants perhaps may be able to answer. We've had a question about training for certified medical assistants. Medical assistants have been definitely a part of this project. We've seen a very broad variety of professionals who have been trained, and many schools, such as the ones that you saw in this webinar, are collaborating really across projects, across programs, with including not only nursing and social work, but also medical schools or counseling, psychology schools, and so on and so forth. So I think there are many, these skills are very transferable to other situations. They're even transferable to other topics. Motivational interviewing will be useful, I think, for any health professional in interacting with patients. So this simulation absolutely is designed to be applicable to all of these professionals. I wanted to give our panelists a chance for any closing remarks. I also wanted to thank our panelists, everybody who has been participating on this panel, Andrea, Valerie, Stella, Shannon, as well as Dr. Tracy McPherson, who has been listening silently and in the background, that has really been a huge driving force behind this project. So a final word from our participants. Any closing? No, well, again, thank you all so much for joining, and we again will make this webinar available to you on demand on our website. You will receive a follow-up email with the link to the recording as well as the slides. Thank you again to all of our participants. Thanks for taking the time to attend. Thank you to our presenters, both for participating in the project and for being on this webinar today. I think we all learned a lot. Final words from anybody on the panel, please go ahead.
Ariel?
Yes, please go ahead.
Yeah, this is Valerie. Yeah, I just wanted to share with the participants that they've heard a lot of different ways in which SBIRT has been integrated, and I would just strongly suggest that if you are interested, that you sort of decide what model may be, or what combination of models may be best for your school, and if any of us can help you with any consultation or any feedback or just running some ideas by with us, we're more than happy to do this, because I see this as very important for social work education, and I think the more that we can proliferate these models, the better. That's it.
Thanks so much, Valerie. Very much appreciated. Any other comments before we finish this session? No, well, thank you all so much again, and I hope you all have a great day, have a great holiday season. Please feel free to email me at cyril@kognito.com if you have any questions. You can see the evaluation link in the chat box. If you want to receive a certificate or credits for this webinar, please go ahead, fill out the evaluation. Thank you all so much again. Talk to you soon. Bye-bye.
Thank you. Bye-bye.
Thank you.